Welcome back to the Brilliant Fertility Podcast. I like to think of you guys as my BFP babes. If you're new to the fertility world, if you haven't been immersed in the fertility acronyms yet, the BFP is that big fat positive that we are aligning towards the mind and the body and soul all beginning to move in that direction. And, I love my mind, emotion, soul work. But today we're actually going to be talking about something very granular and physical, which is AMH. AMH being this test that creates a lot of buzz, a lot of anxiety in the fertility world. And listen through to the end because we're going to be talking about what AMH is, when it's actually helpful and when it's not, and how I'm utilizing this in my practice. So, number one, what is AMH? It stands for anti-Müllerian hormone, and it's a hormone that is released by the granulosa cells, which are the cells lining these small immature follicles in the ovary. So these particular follicles have not completed their maturation yet. They're kind of sitting in the background, giving us an idea of the ovarian pool, but it is by no means a perfect representation of someone's total ovarian reserve, although it can give us an idea of over the next 3 to 6 months, what does that pool look like? And it's also theorized that the better the egg quality, in addition to quantity, the more AMH is produced. So AMH started to get a lot of attention when tests like Modern Fertility came out and you could start assessing your fertility without having to go to a doctor. You could order this test, have the lab draw done as a self-order situation, and then get these numbers and then try to suss out okay, what's next? Am I at risk for infertility? And this was being heavily marketed to people who haven't even been trying to get pregnant yet, but to just better understand what was happening in their body. And the upside is that it can be very empowering to have access to testing that you don't have to wait a year to go see a specialist for. On the flip side, I feel like it created a lot of anxiety to have people start trying to interpret these tests and figure out what they were meant to do next, or causing them to jump really quickly into fertility treatments without understanding what other factors might be influencing their egg quality. And so that created sort of this unique circumstance. And this was when I was about, 4 or 5 years into practice. So at that time, I was frequently measuring AMH in my fertility patients. Almost anyone who came to me, whether they were going to be pursuing IVF or they were trying unassisted, I was testing AMH. Along with, the FSH and LH and estradiol on day 3. And I'll link my whole, my link to the download that I have for the fertility test that I often run. But AMH is one that I've actually shifted a bit on over the last 5 years of practice to no longer testing in every single person who walks through my door. And maybe that's a hot take. I don't know how all of my colleagues feel about that, but I'll tell you a story that really started to shift this for me. This is about 7-8 years ago. I had a woman who came to see me and she was 39 years old. She'd had multiple pregnancy losses, including a stillbirth. She had 2 healthy children from her previous marriage. They were 10 and 12 years old, but she was remarried. She and her partner just, they had so much love for each other. They had so much love to give, and they really wanted to have another baby. So they've been trying for a couple of years, and it was never going to be in the cards for them to do IVF. It was just not something that they were interested in. It didn't align with their personal values. And so we thought, okay, well, that's absolutely fine. I am not morally opposed to IVF or not. It's more of just what does this person in front of me, this couple, need? So we did a bunch of testing, including the AMH level. Her FSH was a little bit higher than ideal, the 13. Her AMH was already pretty low at 0.05. And her cycles were regular, but they definitely needed some help. Like she had some premenstrual symptoms. She had painful periods, heavy periods. And she worked hard, like between being a parent and the job that she had a lot of stress. So we had some really good opportunities to work with her stress levels, to start implementing acupuncture and nutritional changes and more specific slowing down type exercise. She was someone who loved to go for a run. She was just always go, go, go. And okay, like that's great for circulation and just like, getting that cardio in. But in her situation, like we actually wanted to try to give this body an idea that it was safe to get pregnant, right? So slowing down, incorporating more yoga specific type exercise was really helpful for her. She did some yoga that was specific for fertility in the different phases of the cycle. She found that to be really nourishing. She was really empowered by taking supplements. And usually I'm quite a minimalist when it comes to supplements, but she was like, give me everything you got. And so we were using cyclical Chinese herb formulas to match each phase of her cycle. We were using supplements for egg quality like CoQ10 and NAC and NAD. And at a certain point, she did feel that she was improving energy-wise, sleep-wise, her resilience to stress, the actual health of her menstrual cycles, seeing a reduction in PMS and an improvement in the bleed itself. But after 6 months, she wasn't pregnant yet. So we thought, okay, well, is there anything else that we would do? Is there anything we could do differently? We did do some microbiome testing, some vaginal microbiome testing, that revealed that she had minimal lactobacillus growth in the vagina. So we started doing some treatments to help support her microbiome. And I was still kind of a newbie, right? So I'm still a little bit more like throwing everything at the wall, seeing what sticks, like maybe not the most targeted support in the world, but not bad, right? Nothing that would be harmful over time, just maybe not the most specific support in this person's case. And then another 6 months goes by, and I, as a practitioner, was starting to feel discouraged because she's about to get to her 40th birthday. And I'm feeling the pressure. Thankfully, she, as a woman of faith, and her partner, as a person of faith, were like, you know what? Like we feel really strongly though, like this is just around the corner. Like it's going to be okay. We feel good. And I said, well, let's just test your hormone levels. It's been over 6 months. Like I want to see where these have landed. So let's do a recheck of the FSH, the LH, the AMH, the estradiol. Just let's get an idea of where this is. And I get the levels back. And I was so discouraged. Her FSH had gone from a 13 to a 19, and her AMH had gone from a 0.05 to a 0.03. And I was like, oh my gosh, is anything that I'm doing actually making a difference? I was really in a Debbie Downer state about it. And oh gosh, now I have to call her and give her this like not great news. And I call her, and before I can give my news, she says, I'm so glad you reached out because I wanted to tell you I found out yesterday that I'm pregnant. I found out on my 40th birthday and I couldn't be more thrilled. And I was just dumbfounded. I was like, oh, okay, well, never mind. These labs mean nothing to me now. And it was such a good learning experience for me as a young provider to go, oh, maybe AMH isn't everything. Maybe these numbers aren't everything. Maybe everything we were doing all along was enough. And this baby ended up being born very healthy, full-term baby girl. And it was just so inspiring to me to not only have this patient who was 40 years old after all that she had been through, with the numbers that she had, go on to have this extremely healthy baby, but to also see like, okay, well, man, the numbers are only one part of this. The AMH isn't everything. It cannot actually tell us if someone can get pregnant or stay pregnant. And what a relief. Because when we put so much pressure on this one number, and especially a number that we are told is fixed, that most reproductive endocrinologists will check once before an IVF cycle and maybe, again after a year or so, and say like, well, things don't look great if it's under 1. But goodness, to just know that there is actually so much more possible when we don't only focus on this one number. So I hope that case gives you a sense of hope and maybe a relief that you can let go of the attachment to this one measurement. But let's talk about when AMH is actually helpful. So if someone is going to be going through IVF, and this is something that I talk through with my patients in our first conversation, like, what have you been through already? Where do you see yourself going? What treatments feel like they're in alignment for you that you might want to pursue? So if someone is going to be pursuing IVF, it can be helpful to have that AMH. It can be helpful to be able to have an expectation for how you might respond to IVF, to the stimulation portion of IVF specifically. Because if there aren't a lot of follicles in the background to be geared up through that stimulation process, then we wouldn't expect this huge egg retrieval. But it can kind of temper the expectations and allow us to focus on other things. That doesn't mean someone can't go through IVF. It just means that their protocol will have to be really customized to them to support the eggs that are there, rather than trying to squeeze out every last possible drop of energy from the ovary, right? Another situation in which AMH can be really helpful in knowing is if we suspect someone has PMOS, formerly known as PCOS. That's a whole nother episode for a different day. But if we suspect someone has PMOS, polymetabolic ovarian syndrome, the AMH is giving us this clue as to whether we have a lot of immature follicles in the ovary. And when we have a lot of immature follicles in the ovary and we have excess androgen activity and none of those follicles can quite reach maturation, then we also tend to see these long anovulatory cycles. And we see high AMH. So high AMH, like AMH that is above the reference range for that particular age group, that gives us a clue and is actually one of the criteria now for diagnosing PMOS. And I've had some young patients who it was very unclear just based on, looking at them until we did lab work and we did, proper assessment, whether or not PMOS is on the table. And the AMH is actually what gave us that final nudge towards that diagnosis. So that's another scenario in which it can be really helpful. The third scenario where I am testing AMH in my practice is if I suspect someone has endometriosis. So even if someone hasn't started the trying to conceive part of their journey yet, even if they're just coming in and saying like, hey, I'm getting married next year. I kind of want to know where things are. I've always had painful periods and I don't know if there's anything I should be doing about that. That might be a scenario when I test AMH, because if they do have endometriosis and there has been a lot of oxidative stress, inflammation, potential adhesion or scar tissue formation, or ovarian cysts with the endometriosis inside the endometriomas, then that can affect the egg quality. That can affect the circulation to the ovaries. So if we see a disproportionately low AMH in someone who otherwise looks healthy and has regular cycles, that for me could be a clue that we need to refer them to someone for a proper endometriosis workup sooner rather than later. I'm not that person to do that full workup because you need better imaging, more sensitive imaging, and the potential for someone who could follow up with excision if needed. So those are the three scenarios. If someone is going to be going through IVF, if we suspect PMOS, if we suspect endometriosis, where I am utilizing AMH in my practice, but I don't actually measure it for everyone anymore because sometimes insurance won't cover it. And then someone gets this $300 bill for this one little hormone that can't even tell them whether or not they can get pregnant or stay pregnant if they're not actually going to be going through IVF, and that's not helpful. So I hope that gives just a good overview for you of what AMH is, how we use it in practice. And if you do already have a sense that your AMH is lower than the ideal reference range and you're feeling anxious about that and you've been spiraling, please know that there are some things that can influence egg quality. Sometimes we see a little boost in AMH. Sometimes we don't. I no longer obsess over it because there are other factors that we're looking at in the health of the cycle to understand if the treatments we're using are moving in the right direction. We're looking at nutrient deficiency. We're looking at inflammation. We're looking at how well your body regulates blood sugar and insulin, how our microbiome and that milieu of microbes is supporting the vaginal, what do we want to call it, environment, the endometrial environment. There's just so many other factors that we can influence positively, regardless of what that number for AMH is. So if you've been really spiraling around that, feeling anxious around that, losing sleep over it, please know that we can piece through this together. You do not have to do this alone. And if you feel a tug to investigate that with me, we always just have a link to explore a discovery call with me in the show notes. So you can grab that link, explore that option, and know that help is available. I do not believe that this is an area that we are meant to DIY. Heck, I just got my labs drawn this morning because I'm due for my semi-annual hormone, thyroid, all the things check. And I don't interpret that myself. So I don't expect you to have to do that either, even if you are a highly intelligent, high-achieving woman who knows her shit. It feels really good sometimes to heartstorm, brainstorm, really piece through this with someone who's got your back. And I have learned just way too many times in my career to stop judging a situation, to stop feeling like, oh, this might not be possible because, oh my goodness, I get so pleasantly shocked on such a regular basis that I surrender. I no longer have any expectations of how these numbers could influence the potential of pregnancy or not, because we just don't have control over any of it. We can do our best with all the things that we have influence over, and we have to learn how to surrender the pieces we don't. So deep breath, letting go of the stress about AMH, trusting that there are other elements of your health and fertility that you have some influence over that you can get support with, getting that support, asking the questions, standing up for yourself, advocating for yourself to get better support. All of that I am so here for you, and I'm sending you so much love. Until next time, friends.